Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Over 60. The third thing is to call a relative or a friend we haven't spoken to in a while. And I'm sure all of us have some friends that we haven't spoken to for whatever reason, because you just never take the time to talk to all of your friends. So you have some one or two friends who you haven't spoken to in a while, and call them and give them an update on how you're doing and find out how they're doing. And that's often refreshing. Sometimes it can be depressing, but more often than that, it can be refreshing. And then it says day 4, ask for help. We all can use some help in some ways. Sometimes the help is just say, give me a call sometime, or when can we get together, or what are you doing? Any programs we can share together. So call somebody and ask for help, because that puts you together with someone else, which is a good way to address the loneliness. And then put away the cell phones and actually have a face-to-face conversation and talk with somebody. You see these people at dinner table and everybody's got a cell phone. And these days, cell phones reign supreme, and so put them away and actually use the phone, call somebody and talk with them and have some FaceTime. And I think that those are some of the things. Loneliness, of course, is one of the greatest adversaries in this time of the holiday season, which is why the suicide rates are highest between this holiday season and New Year's Eve. You have suicides, and you have more organ donations as a consequence. Any comments or thoughts about the holiday loneliness that people experience? The older you are, the more friends you lose along the way. So any other thoughts as how you address your loneliness during the holiday season?
Dr. Callender, my father died on the 26th of December, 2012. And so it puts a pall over the whole holiday season for me. So what I try to do is I try to do something for other people. I try to reach out to other people, and I try to I do volunteer. I do things like that, and I do that in memory of him.
Great idea. Any other ideas?
I like the idea of FaceTime on the phone. I mean, just talking to somebody is good, reaching out and, contacting someone you haven't talked to in a long time. But FaceTime is even really cooler, I think, than a regular voice call.
Thank you. Because you can see him. Yeah.
Yeah. But, I've seen what you're talking about. People at the dinner table and everybody's on the phone talking to somebody else rather than the person right next to
you. Right.
Very strange.
Yeah.
I've seen that at intersections downtown in DC. You know, 10 people are standing at the corner waiting for the light, and 10 people on the cell phone, and nobody.
Yeah, and they cross the street the same way. That's why we have so many accidents. Yeah. Any other comments?
Good morning, everybody. I like the idea of joining a group. About a year or two ago, one of my old girlfriends I hadn't really seen in a long time invited me to join a Bikino group in her senior citizen building. And so twice a month we have been getting together, and I met new people, and it's a good fellowship. So
Great. Yeah.
that's a good idea to do that.
Yeah. Mm-hmm. Any other thoughts?
Sometimes I have moments when I think about my family who have closed their eyes, and instead of thinking about negative things, I think about the happy thoughts. And I know we've had a lot of happiness in our family, and I think about those, and that really helps me through those moments of those.
Any other sharing you want to do about that?
Yeah, I'm trying to get my sister on board with this loneliness thing because she's getting into a bad habit of eating by herself. She used to go down to the dining hall and sit with a group of people, but now she's changing. She wants to eat by herself in her room, and I don't think that's good.
You have influence on her?
No. Zero.
No.
Carol probably has some influence on her. Carol is not on the line right now. But yeah, she's trying to help her, to be more social, go down and, they all eat breakfast in their room by themselves, but they go downstairs to the dining hall for lunch. They go down for dinner, and and guess what? It costs more for them to bring the food up to her room.
She doesn't care.
So that's not a benefit. She needs to go down and be with other people, like she had been doing.
Yeah.
But I think there's some depression mixed up in there somewhere.
Yeah.
John, speaking about your sister, if you could share with me her address and stuff, I'm going to talk to the senior circle people at Liberty. She was a part of our group.
Right.
And maybe I can get them to go visit or something.
Okay, I'll do that.
Maybe help cheer her up. Yeah.
Okay.
Well,
Yeah, I think
Carol's back on the line. I was telling him about Joyce is having a hard time going down eating with her other friends, and we're on the discussion of loneliness.
Hers is more in the form of she's in a place where she really doesn't know but what to be, but she needs to be there, and she realized she needs to be there because it's helping her. And not so much loneliness because she got people around her. She's just depressed about it in a facility that she'd rather be at home, no matter how much she's not receiving help, but she's in a place that's receiving help. So that's a conflict. So during this season particularly.
Do you have any influence on her going down to eat with the rest of the group? Dinner?
No, I'm calling all the ones that do, like her sister and her daughter and etc. If they can work on her,
Any other thoughts? If not, there was an interesting article in the Washington Post also that said that they did an experiment in which they decreased the salt intake by 1 teaspoonful a day, and that significantly lowered blood pressures. Some people just love to eat salt and they think they can't have food without salt, and they don't forget all the other ways that you can make food taste good without salt. But they did this research on hundreds of people and identified that just decreasing salt intake by 1 teaspoonful is enough to lower your blood pressure, which is interesting concept. How
Has
many of you
anyone
still
ever
use?
had potato chips without salt? They
No,
do make it. Try one.
no.
It
Yeah,
tastes like cardboard.
We are so used to the salt on the potato chips. So when you
Absolutely.
actually eat the potato chips without salt. But anyway, we shouldn't be eating potato chips anyway.
Mhm.
so they Lay's LAYS has a brand, they call them baked potato chips, so it doesn't taste like anything, but I mean but it's healthier for you.
Just
Okay, I
buy a
guess.
smaller bag and don't worry about it.
Okay, okay, John. I guess you can start the. Oh yeah, this is something I put together. Guidelines for health screening in older patients because it was interesting because there's a couple of articles that talk about the fact that after certain ages you may not need to be screening. For example, we've talked about this before that cervical cancer screening, which is pap smears, are recommended up to the age of 65, which doesn't mean that you no longer need to see the gynecologist, but it means you don't need to get a pap smear for cervical cancer. And of course, if you've had HPV vaccination, that also decreases the need for getting pap smears. Second, colorectal cancer screening is recommended with colonoscopy is recommended through the age of 75. For people at average risk, it's not recommended for adults at average risk after the age of 75. But of course, if you have a different history, you have cancer in your family, then that's a different story. So average risk means that you don't have a family history of cancer. And for women at average risk of breast cancer, screening with mammography is recommended up to age 75. People still have cancer of the breast after 75, but the mammography is not thought to be necessary after 75. This has nothing to do with if you feel a lump in your breast, because that's different. Because that's not screening, that's taking care of a problem. Individuals may be encouraged to continue screening at old ages if they have a personal history of cancer, a family history of cancer, or a history of genetic mutations that put them at increased risk for cancer. If there's no family history, most people over the age of 85 should no longer need cancer screening. We're going to say if you have symptoms that are concerning for cancers, such as bleeding or having a lump or a change in the color of your skin, this is not considered screening. This is considered a workup for a potentially serious problem that you need to have taken care of anyway. And that really is just to remind you that screening is to try to take care of something that is not symptomatic. And so therefore you can catch it early and prevent cancer from developing. Lung cancer screening is recommended for adults age 55 to 80 who have a history of smoking, including those who quit smoking within the last 15 years. The recommended screening is a low-dose CAT scan of the lungs, which primarily involves those who smoke or those who are victims of secondary smoking. And many of us have had a history of being around people who smoke, especially those who are married to people who smoke. Men over 65 should have an abdominal ultrasound to screen for an abdominal aortic aneurysm. This condition may not have any symptoms. So ultrasound, which is painless and not uncomfortable, is something that you can do without any complication. So we said men over 65, women over 65 can have it as well, but it's just that more men have abdominal aortic aneurysms than women. But so there's no reason why a woman who's over 65 couldn't have an abdominal ultrasound as well to make that diagnosis. The other thing that we recommend is getting the cholesterol checked every year to help identify, see if your cholesterol level is high, because cholesterol-lowering medications may be necessary to prevent the development of arteriosclerosis and other conditions. So these are some of the hints that I shared. Any comments or questions about the screening issues?
I had a question. I wanted to know what is meant by a low dose CT scan.
Okay, well, low dose means that this is not the same CT scan that you get for other conditions. So a low dose CT scan is a CT scan that's done for the lungs that has a lower dose than the regular CAT scan. So they actually have what they call a low dose CAT scan, lung CAT scan for those smokers.
Sylvia has her hand up.
Yeah, Dr. Callender, good morning, everybody. How do they detect if an individual, like my mom's 91, and she doesn't do a colonoscopy? How do they detect after the 75 if there are polyps that need to be removed? How would they know that if they're no longer doing the colonoscopy?
They wouldn't. That's why if you have a family history or if you have symptoms, then you should have a colonoscopy. But if you don't have any symptoms, you have normal bowel movements, you don't have any symptoms at all, and you have no family history of cancer, then they're not suggesting. But the point you're making is that you can't make a diagnosis of polyps if you don't do a colonoscopy. So if you have any history of, but I think the data suggests that the likelihood of you having anything like that is not common. But there are exceptions to the rule.
So if you had a colonoscopy and every time you had one, they had to remove polyps, do you recommend that you still get them over 75?
I would think so. If every time you have a colonoscopy, they have to remove polyps, that's a suggestion that you are a polyp former. And so, yes, that would make it different because you have a different genetic makeup. And that would mean that you, because they recommend colonoscopy every 10 years if you have no polyps. But if you have polyps, then you need to have colonoscopy every 5 years. And if that is the case, then you fit into a different category.
Okay.
Dr. Callender, first of all, excuse me for not being visible. John helped me log on, but John, I don't know which magic button to push so that you can see me. But Dr. Callender, my question is, oftentimes with my family, we talk about health a lot. All of them are saying that they don't have to have a colonoscopy, but every 10 years. And if you've had polyps and then the next time you have your colonoscopy, they're not detected, do you still have to do what's required of me now? 5 years, they just won't go to 10?
5 years is only if you have polyps. 10 years is if you have no polyps.
Yeah. And so I asked that the last time I had my colonoscopy, we'll see you in 5 years, but you just said I don't have any polyps, but I want to see you anyway. Okay.
Okay.
So maybe that's his preference. I don't know.
Yeah, maybe, may well be. But there are exceptions to every rule, and if you have a family history of cancer, then that would make you different.
Mm-hmm. Okay.
And the other issue is if you have a condition that's gonna cause you to die within less than 5 years, that's another reason for you not to have screening. But
And my sister
good
just
question.
had one. She has hers every 10 years, and she's 70. And he told her she didn't have to come back.
Yeah, that's because her next time would be 10 years from then. She would be 80. And the reason they say that screening colonoscopy after 80 is not recommended is that there are some complications associated with colonoscopy. And when you get to the point where the risk of complications of colonoscopy exceed the risk for you developing a polyp, then the screening is no longer thought necessary. But that's an area of controversy. But this is in general, if you have no history of polyps and you have no diarrhea or constipation or any of that, and then it is thought that you don't need to have colonoscopy.
Okay, thank you.
Carol?
Yeah, Dr. Cal.
There's a test that advertised every once in a while. We get it in the mail, and it's in Annapolis Hospital, I guess, that you can get this one body scan that detects everything. You know about that?
Yes. As a matter of fact, most rich people do that.
Rich people, how much that thing costs?
I don't know what it costs, but I do know that for example, one of our surgeons, his mother gets one about every 5 years or so. But yeah, it does a complete scan from head to toe and can pick up early. I don't know the cost of it, but it is available, and people who have the funds would do it every year or every other year.
Well, it seemed like doctors would have the funds, right?
Well, that depends. Not necessarily, but it all depends on your priority. But that's something that, for example, they have a program for so-called rich people where this is part of what they do every 5 years. And they have that MRI or CAT scan equivalent that x-rays you from head to toe. And if they find anything, sometimes they find very small lumps or bumps, relatively insignificant areas, but then it's a decision as whether you want to do something about it. But it's something that it's recommended if you can afford it every 5 years to do something like that.
Okay, does it, you also don't have to have that blood test, or does you have to have a blood test too? Because some things can only be determined if you have a blood test, right?
Well, the blood tests are ordinarily done, so that's understood. But the X-ray is something that picks up lumps that would not be detectable otherwise. Something that you wouldn't be able to feel or anything else. Only the X-ray could pick it up, and this can allow for early diagnosis and early treatment of conditions that wouldn't otherwise be diagnosed.
Okay, I'll find out how much it costs.
Okay.
$860,
$860?
$850.
Okay, it's like a vacation.
Hmm.
Instead of going on a vacation, just get scanned.
That's right. You're right. Any other comments, questions?
I have a
Dr.
question.
Yes, Mary Ellen?
I have my father got colon rectal cancer at 89, and my mother got breast cancer at 90. So that's, my family, my brothers and I have to get our screenings every 5 years. I had polyps only one time in the last 15 years. But I was in a trial. I like to do the studies and be involved in those. And I was on this trial for smokers doing the low dose CAT scan back in 2005, I think, or 2006 we started. And I did it all the way up to 2015 when I developed thyroid cancer, and they didn't want me to participate anymore after I did that, but I did screenings every year up until that time, and I was in that study.
So had you been a smoker before?
I smoked for 40 years.
Yeah, okay. Yeah.
And
Yeah,
I
you
I had stopped. I think I had been stopped 5 years when I started the program. 5 years when I started in the screenings. But like I said, once I got thyroid cancer, they didn't want me to get the low dose radiation anymore. So
Yeah.
I haven't had one since then. Do you think that would be something I could do now, or should I not do it?
I think you qualify.
Okay.
Because you stopped smoking how long ago?
2005.
Oh, when did you say 21?
2005.
Oh, yeah. So yeah, who quit smoking within the last 15 years. So that's you. So actually 2005 would be 18 years, right?
Right.
Yeah. So you may not. It says those who quit smoking within the last 15 years.
Right.
So you wouldn't qualify. I think when you were doing it, you fit right into it. But as time
Yeah.
has gone on. Yeah.
Right.
Yeah.
Dr. Callender, I worry when they make recommendations like that old people's lives don't matter. That's what I wonder if, because a lot of times they'll say, well, do you want to get treatment? They asked my mother, do you want treatment? And she looked at them all crazy and she said, did you just tell me I had cancer? And the doctor said, yes. So she said, yes, I want treatment. She got indignant because he asked her, did she want treatment?
Well, I agree with him.
And I understand that. And I wonder sometimes when they say, oh, after 50, you don't need to do this. I'm like, I got my lady parts all. I want to be here. I want to live. So I'm going to go on and get my screenings because I care if you don't. That's my attitude.
Well, as I stated, the concern is that when the screening procedure is more likely to cause complications than it is to prevent something, then the option is yours. It's just that there are complications from every procedure. Colonoscopy has its complications. Mammography is often uncomfortable, and so I don't think the reason that they're saying not to get it done after those ages is because that you're likely to die. What they're saying is that when the procedure is more likely to cause complications than it is to help you, then it's optional. And they recommend against it. Colonoscopy is a great procedure, but it has complications. People have died from colonoscopy, and so that's the concern. It's not that they are concerned about the fact that you are going to die soon, because the expectation is if you're going to live 10 years, then the option of getting a colonoscopy is there for you. But the recognition is that colonoscopy in people who are older than 80 may be more risky than it is for somebody who's 70, because you may have complications. And we've had doctors and other people who had colonoscopy who died from complications of the colonoscopy. So that's the reason. It's not because and I think your relative was quite appropriate. If you tell me you have cancer, of course I want to be treated. Right, because cancer is a lethal disease if it's not treated.
Right.
But I think your point, I think it's appropriate for you to have, and if you have a family history of cancer, or if you have a genetic history that shows that you have vulnerability, then that's an exception to the rule. And that's why we mentioned under item number 4 that if you have a personal history of cancer, family history of cancer, or any genetic mutation that gives you an increased risk of cancer, then this does not apply to you. So I think the questions are very legitimate, and it's appropriate to take it into consideration that one size does not fit all, particularly if you have a family history or personal history of cancer.
One of the complications of colonoscopy can be reaction to a general anesthetic. So my suggestion would be to ask your doctor if you can get the colonoscopy without anesthetic.
Well, the complication of colonoscopy, the greater complication isn't the anesthesia. It's actually the perforation of the colon by the colonoscopist, which can be associated with lethal complications. People have died from that. And I just thought that the older you get, the more fragile the colon is, and therefore the risk of perforation is considerable. And that's the reason why they are saying that after a certain age, if you have no personal history of cancer and you have not been a polyp former, that maybe you might do without the colonoscopy. Anesthesia is just one of the complications. That's not the greatest complication to me. The greatest complication is death, and that can occur if you perforate the colon. And we've had examples of that.
I have a question, Dr. Callender. Number 6, I think. No. Number 7. What is an abdominal aortic aneurysm?
Okay, that's where you have the abdominal aorta, which is the largest blood vessel in the body. And what happens if it gets larger than 5 centimeters? That's abnormal, and it means that if it gets larger than that, it may burst open and you bleed to death. So if you get an ultrasound of the abdomen and it shows that your abdominal aorta is normal size, then that's fine. But if it's larger than normal, the possibility of that being an aneurysm, which could rupture and kill you, becomes greater. And for men over 65, this is a concern. I think this is what Albert Schweitzer died of. They made a diagnosis, but he didn't want to have surgery, and his aneurysm ruptured and he bled to death.
So how often would you have that done?
Probably every 5 or 10 years.
Okay, thank you.
And the ultrasound is painless. It's not uncomfortable at all.
It tickles.
Yeah.
I would
Okay.
like to address the mammogram issue. Now I'm 79, going on 80. And my primary care doctor still asks me about doing my mammogram every year. So looking at the age of 75, I've been having mammograms ever since you're supposed to start. And I've never had any abnormal mammogram. So I'm wondering now why every year, and even my insurance people call on a regular basis for me to schedule my mammogram. So
Well, I think that there's a good reason why people consider, people over 75 do develop breast cancer. And the reason that they are suggesting against it is because sometimes the mammogram will pick up things that aren't cancer, and they will require operations that may not be necessary. But I think if your doctor thinks you should have a mammogram, then go for it.
yeah,
Especially if the mammogram is not particularly uncomfortable to you.
yeah, well, that's that same doctor that my physical was on the phone, my yearly physical.
Oh my goodness. Oh man.
Fortunately, I'm not a person that have a lot of problems. I don't take any prescribed medicine or anything like that. But I'm just wondering, after looking at this, why am I still doing a mammogram every year?
You're here. You're still alive and you want to stay alive.
Well, but you can see that they recommend against it. So
yeah, that's my thing. If doctors are recommending against it, why is my primary care telling me to? And
yeah, it's interesting.
my insurance calling.
Yeah, well, this is the newest recommendations by the Cancer Society. So take it with a grain of salt. I mean, I think, but this is their recommendation. So
yeah, but other issues, family history too, that plays a role in it for
major role.
Yeah,
family history and genetic predisposition.
She's shaking her head. No, no
family history. No family history. So.
Well, anyway, these are the recommendations of the American Cancer Society. So use your judgment, but it's done with a lot of concern and forethought that they don't want people who don't need to be screened to be screened. People who need to be screened with history and genetic situations, that's another story.
And actually, my colonoscopy, the same thing. My doctor is asking us to come every 3 years at our age instead of 5 or 10. So
what can I tell you?
This study tells me a lot.
Well, I think what you do is you ask your doctor, tell them this is what the American Cancer is saying. What do you think about it? Do you think that that's reasonable, or should you still continue to ask your doctor about it?
That's what I agree.
Tell them that you got this information, and you'd like to hear what they think about it.
I agree with that.
Janice, you had a question?
Yes, I do. I had I'm like Betty. I go every year. I'm 73, never had a problem. And the last time, a couple of years ago, a year or so ago, I had to come back. And they wanted me to come back every 4 months, every 6 months. And then in October, they said I was good and I don't have to come back for another year. I had a visit this week with my primary care doctor, and he was looking at the results of my mammogram. He said, oh, it looks great. It looks great. No signs of calcification, which was the diagnosis that they had, which is why they released me back to once a year. So if now there's no calcification, how does that go away? How does it come? What causes it?
Well, if now, are you saying you had calcification and
Yes.
oh, I see.
Yeah.
I don't know. I don't know the answer to that question.
Yeah. And
Because
so this
usually,
week he said, oh, it looks great. No calcification. Okay. I didn't do anything, but I'm just,
interesting. Hmm.
yeah.
Well, you know, if you have dense breasts,
Yes.
then it does require different testing. So if you have dense breasts, it's a little different than if you don't have dense breasts.
Yeah. I have dense breasts, and now they do, what is that? The 3D or whatever that extra mammogram is. And that's what I have now.
Oh, okay. Well, if you have dense breasts,
Yeah.
then that would be an additional risk.
Mhm. Okay. Anyway, I'm calcification free, whatever that means, but that's good. So I'm
Yeah.
gonna leave it at that.
Yeah, because that is often associated with malignancies.
Mhm.
Any other comments or questions about this apparently controversial screening issue that American Cancer Society has put out? It's food for thought, and discuss it with your doctor, and then your doctor who is examining you in some instances can kind of defend his or her position on the subject, because the Cancer Society is looking to do what is the best interest and the safest for patients at all ages. Okay, well, that's got a real healthy discussion of this is the comments from the yoga master. Is this the one? Yeah, okay. This is to let us know that as we enjoy ourselves during the holiday, that we keep in mind some do things that enhance our digestion and detoxification, do things that alleviate our stress, uh, uh, have a holistic health enhancement ideas, and I think cultivates inner peace, increased flexibility, yoga, as well as the things that Darryl has talked about forever, are all aspects of this. And then, of course, yoga itself, with its breathing and its exercises, is all about peace and tranquility and doing what is healthy. John, comments you want to make?
This is from my yoga instructor, and if you're interested, she has classes online 3 times a week, and if you want to check her out, the the link is at the very bottom. You can click on that, and it'll take you right to her website. But it's something you could do right at home. You don't have to go in. We used to meet in person, but with COVID now everything's online. But yoga definitely has a lot of benefits. So I just wanted to include that. That's it.
Thank you very much. Very good. Okay. Well, you know, it's in the United States, it's just something that every week it seems like we have another mass shooting. And this article actually re-examined the connection between mass shooting and mental illness. And in over 85% of the cases, it identified that they actually did have mental illness associated with it. And one of the problems with mass shootings is that many of the people who do these mass shootings, they kill themselves after they do it. And so the opportunity to really discuss their mental history is not possible. But talking to their family members and others, they have been able to look at some 55 shooters and were able to identify that 87.5% had different psychiatric diagnosis, with the majority having schizophrenia and other personality disorders and PTSD as well. So, and we just had this Las Vegas shooting yesterday. I don't know. We did not yet know the history on this person who subsequently shot themselves. And many of these mass shooters kill themselves or they get killed in the process. But it is clear that mental illness does play a role in many of these shootings. Any other comments or thoughts about this disastrous problem that we face in the United States that many other countries don't have this concern? Any other thoughts about it, Carol?
Yes, I was just wondering, St. Elizabeth, since they've closed down, do we have any facility that's like St. Elizabeth, or they're not known, or what facilities do we have to treat mentally ill people?
Well, we still have St. Elizabeth's and other places that treat. Most hospitals take care of mentally ill patients.
Oh, okay.
And most hospitals do, and then of course St. Elizabeth does as well.
So they're still functioning?
What's that again?
Is St. Elizabeth still functioning?
Yeah, it still takes care of some mental ill patients still. Although we all recall when they dumped all of their patients out on the street, and many of the homeless were mentally ill patients. Mark, you had a question? Or comment?
Just a comment on the mass shootings. I think it's a symptom of America. This is just my observation. This is just a symptom of Western civilization where we are now. Yeah, mental illness is a part of it, but I think it's just one part. You know, the mindset to kill others. That's a psychopath in and of itself. But then there's access to guns because there's a thing of kid shooters, and teenage shooters and things like that. So there's access to guns. There's and even when it comes to I've seen stuff where it talks about video games and such, and so it kind of puts certain people with a certain mindset into this trance of accessibility, of saying that these kinds of things are possible. You can shoot up entire swaths of people, with little or to no effort, But I think it's beyond mental illness. It's just a perfect storm of what's happening in particularly Western civilization altogether.
I agree. I agree with you. I don't think it's just Western. I think it's U.S. mentality. It's a gun culture, and it's fueled by white supremacy and the fear of losing their status as being the predominant and the favored race. They're afraid of all the minorities because of all the things that they have done to us over the past. And in the United States, they keep talking about the Second Amendment. They talk more about the Second Amendment than they do the 10 Commandments. And they act like the Second Amendment came from God. So I think it's a USA mentality, the gun culture. And it's not just mentally ill. I think you can warp into that. But it's a lot of people walking around, they got a gun mentality, and I don't think they're mentally ill. I think they're evil, but I don't think they're mentally ill.
Well, the psychiatrists say that 87% of them are mentally ill. So that's all. They only say that of the people that they studied, 87% of them had mental illnesses.
Mhm.
Okay, there's a lot I got to deconstruct here because I hear reference to minorities, and melanated people are definitely not a minority. When you include the 1 billion melanated people in sub-Saharan Africa, and there's another about 1.5 billion dark-skinned people in the Indian continent. So you got 2.5 billion people out of 8 billion people on the planet, compared to Caucasians. European style Caucasians are about 500 million. That's less. That's 500 million. We are not a minority. Some people say that we don't have a gun problem. We've got a mental health problem. And, we just said that access to guns is a problem, which is very true. But when you do a Google search on what country has the highest rate of mental illness, United States is number one. Colombia and Netherlands and Ukraine tended to have higher prevalence of estimates across all classes of disorders, while lesser developed countries, Nigeria, Shanghai, and Italy, were consistently low, and prevalence was lower in Asian countries in general. So richer countries have higher rates of mental health issues compared to poorer countries. And one of the reasons we started off talking the conversation about loneliness, and in richer Western countries, there's a higher prevalence of single family households, where in lesser developed countries, you have multi-generational households. So loneliness, mental illness is really a modern problem, because when you have multi-generational households, it's hard to get lonely when you're living in a house full of people. It's hard to have a lot of the mental illness problems without loneliness. And when you're in a house full of people, you tend to be saner. So, we like to be selfish, and we've got family and extended family that we want to put them in different places, stay in your own house or go to assisted living or a nursing home. But if we have the multi-generational households, it would solve a whole lot of problems, including loneliness and gun volumes, gun issues. There's a whole lot of kids, especially white kids. They stockpile all these weapons as 16-year-olds, and they build bombs and all of that. And parents said, I had no idea he was doing all of that. Well, if you're in a multi-generational household, everybody knows what everybody's doing in that house. So, encourage some people to move in with you, and we'll solve the world's problems.
I have a question.
Shoot.
John Tatum invited me to this conversation, but what constitutes mental illness versus anger issues? I mean,
well, they qualify different, because personality disorder is still a mental illness, but it's not the same category as schizophrenia, but it's still, and of the diseases that you can treat, personality trait disorders is probably the most difficult to treat, because you have medication for the schizophrenia and some of the other ailments, but for the trait disorders, once you've got them, you've got them. And so it's still part of the mental illness category, as you see them identified here. And so to me, it's clear that many of them have mental illness issues. But that doesn't mean that it's 100%, it's 87.5%. So you got another 10% who may not have had mental illness. The other issue is that some of them just kill themselves after they do it, and so you aren't able to ascertain the extent to which their mental illness existed or did not exist.
So very quickly, so you said the difference between anger and mental illness. The first thought that came to my mind is, everybody gets angry, but I think where the mental illness starts probably is where people act out on that anger, or they act upon their what's being called intrusive thoughts. Everybody has those kinds of angry thoughts, and most people would just see to themselves or just talk about it. But I think where it just crosses the line is where people act out, or they act out their revenge, or they act out their thoughts. I think it's the behavior that kind of makes the difference between just being regular angry and then tipping over to mental illness.
Nobody said anything about the food we eat and the water we drink in the rich countries.
No, no one has found any association of that yet. Any other comment, Jim or Janice, or anyone else?
I kind of also think our programming on television and the different things that you can reach through your phone has a lot to do with some of the behavior. You see, it used to be back in the day that you just had normal things on TV, but now everything is a shoot up or a crime, or so I think that has something to do with the mindset of people. They see it, so they feel like they can do it as well.
Especially if they're lonely and they're mentally ill.
That's true.
I have one question, particularly for Darryl. There's always been mentally ill people and living in the house, and I'm just thinking, we do this to people. We isolate them, even our children. When you're raising a lot of children, it's poor countries, they're all piled up in one bedroom, piled up on each other. In rich countries, they got their own bedroom and their isolation. But with our country, we have mentally ill people in our families, and to take them into your family, into your home, is upsetting because we don't have the facility, since they weren't raised around us. And then all of a sudden you dump this mentally ill person in your home. I don't think it helps them, not one bit. So when you say, we all need to be back in the house together, you would have to start that way. You couldn't end up that way. I don't know if everybody has someone that we know should have been committed, but they're not. And to have them to come live in your house, I don't know. Probably I would go mentally ill. I don't know. I'm just rambling. But he was saying, we all need to be together, and all these individuals and everything. Sometimes it's just that peace and tranquility that John Buchanan was saying. When you do yoga, you can't do yoga when you got a house full of people.
Well, I take you back to the movie Soul Food. That's the movie about black family who met at Big Mama's house every Sunday for Sunday dinner. And they had crazy Uncle Charlie living upstairs. They locked him in the room, and they just threw his food in 3 times a day.
Yeah.
I like to say something. I grew up in a multi-generational household, and across the alley from the Tatums. And we grew up in a culture where, in that household, the family unit cared about one another. And in our neighborhood, our neighbors cared about us as children. So when we did anything, just to give you an example, Kevin Tatum and I were best friends. And if Kevin got in trouble, and if I was at Kevin's house, Kevin would get a spanking and I would get a spanking because I was with Kevin. And I would be sent home across the alley, and the Tatums would let my mom know that I got a spanking. And when I got home, I got another spanking. So we lived in a community where the parents cared about each other's children. And we've lost that morality. We've lost that sense. You can't talk to a child. You can't berate a child now or even correct a child. The Bible says, train a child in the way that he should go, and when he gets older, he was not defer from it. But those semantics have been lost over a period of time, and I kind of question why, because if we were brought up like that and we trained our children and their children, our children trained their children, where was that space of time when that was lost? Because nobody respects that anymore. People don't respect, young kids don't respect, older people. I call Johnny's father Mr. Tatum, and his mom Ms. Tatum. I didn't call them by their first names. And that's the respect that we were taught. And we grew up that way. And that's been lost. So I can't understand. I mean, it's the Wild West out here now. And those morals, those values have been lost.
Just to kind of put some academic terms to it, what we're experiencing and what you guys are talking about is individualism. Western society, America in particular, is most noted for that. We're focused on individualism, and there are a few other countries that are like that, but we're kind of like the flagship. And then, but as opposed to collectivism, where it's about the whole, it's about the family group, the family dynamic, more than it is about individual accomplishments. And there are a few countries that are collectivists, as a collectivist society as well. So I think we're battling those two dynamics, or we're battling the individual. We're realizing that there's a lot of fame and glory for individualism, but we see that there's also a lot of there's huge downside to that as well. We're not thinking about the whole or the unit and that sort of thing. So it's just kind of the world we live in.
Carol, you want to say
Okay.
something again?
Again, I'm going to say this.
It started in the 60s civil rights era. Special ed started where children had rights.
It's our generation that put in all these laws. Now that Blacks have rights, children have rights. Everybody has rights. When they put in the law in the school, children have rights. Then they said children cannot be abused anymore because someone went over. So parents cannot chastise. Then they came up with the drug war and they instructed children, stranger danger. So if they weren't your parents and they were just neighbors, they could no longer by law chastise you. And you have every generation blames the last generation. They never blame themselves, but it's whatever generation during the 60s and 70s and 80s that put all these laws in place. When I first started teaching in the 70s, in certain states, you could have corporal punishment, but in other states, because of the civil rights era, no longer. Now children and parents can be prosecuted because of physical abuse unless they scare their kids enough. Kids cannot, no stranger can chastise a kid unless their parents enforce that. So laws have changed. We're going to have to stop thinking how it used to be. Look at the laws of how they are and see. I used to teach. In this day of age, I cannot have those same concepts and what my culture was in teaching today, because you can't even make a child right over and over. I will not kick the teacher anymore, nor will they get chastised, because that's called abuse. And these laws have been put in place. Now, unless a household has just
completely ignored it and they don't get caught with everybody's phone camera that they're abusing their child and then be brought up for charges. Even if a teacher is attacked and everybody got their cell phones and see that a student goes across the room and attacks the teacher, but it's all on the phone, that teacher still will be fired. Even in the 70s, if a child attacks them and they hit the child back, once you hit that child back, you have lost your rights because the children have their rights. So we're going to have to stop thinking what used to be, yeah, that was fine for our generation, but think about, we at least got one or two that are still working in this society. It has changed so much. And we're wondering why we're more mentally ill, because we don't have those safeguards. We don't have the family group. We don't have the family neighborhood. People can live in a neighborhood for years and not know their neighbors. So that's all I have to say, because I could say more about that. Oh, they also got rid of textbooks.
They also got rid of prayer and the Bible.
Right, you can't pray in school except for when somebody dies and they say, oh, let's give them a moment of prayer. So you got to die or something and everybody got that silent moment and you pray to whomever God you have. But but even though Congress still prays, but anyway.
No, you could still at my school, at my high school, they allow the Muslims to go to a quiet corner and pray. But so I got to look up and see what the exact rule is. So I guess they're trying to ban corporate prayer, because also I heard about at my school the last principal would make everybody, like, she would call a staff meeting and she would end it with prayer, like whether you were a Christian or a believer or not. So so it was a bit of abuse of power. So so I think it goes back and forth. Like I think it depends on what the rule of law is.
Yeah, they also had a law teaching music. We could not say the word Christmas. We had to have a holiday break because you couldn't use Christmas. But I still sang Jesus is the reason for the season anyway, and I wasn't put in jail. But it's according how bold you are. Muslims can pray, but Christians cannot. But that's a whole new different subject.
Yeah,
That's
it
the
used to
same
be
subject.
part of the educational process was to teach children to be good citizens and good people. And so civics were taught, ethics were taught. But when you remove that, you remove some of the guardrails. When you teach people to be good people, they'll behave accordingly. When you remove that, then especially when you combine it with what Mary Ellen was talking about, the lack of censorship. So where every time they see a movie, there's gratuitous killing, violence, and sexuality. We're teaching them to be the complete opposite of good people.
Okay, any other final comments? We've discussed it appropriately. Okay, moving on to SAD, seasonal affective disorder, which is something that, again, a mental health issue that, and you can see it itemizes the symptoms. And as you look at them, you can see a lot of people who have all of these symptoms when time changes. What is good about this article is that not only does it talk about what SAD is, but it also talks about ways to treat SAD. And it doesn't quantify how effective the treatment is, but it does identify the risk factors for SAD and the what they allege are the causes of SAD, as well as the treatment of SAD. And most of it is by antidepressant medications and psychotherapy and phototherapy. But it doesn't quantify the extent to which the treatments are successful or unsuccessful. But it is an entity that is more common than we'd like to believe, and results in depression that can have suicidal consequences. Do any of you know people who have SAD?
What do you say? What does SAD stand for?
Seasonal affective disorder.
Oh, okay.
Yes.
Yeah, it's a lot more common than you might think.
So yeah, I knew someone who for this was a problem, but I was reading some other literature on this, and I saw where it was pretty much generational. Like it was beyond just the season, beyond just the losing daylight every hour. Um, it was it that and it became a thing where it was about this time of the year, way a long time ago when they were pregnant. And this is a bit of a stretch. Please be bear with me. When they were in the womb, they first their mother first realized that they were pregnant, and it was basically an unwanted pregnancy. So that kind of feeling kind of was transferred to the baby, and it's like so every year around that time they kind of get these feelings of unwantedness and sadness about that same time. I found that to be quite strange as a correlation.
Mm.
Yeah, I'm familiar with this syndrome, and it is real, and it's triggered by the lack of light. Uh, and I think it's tied, like I said, to the circadian rhythm a lot. But it it also might uh, be exacerbated by having background depression anyway. I mean, a lot of people suffer from depression, and uh, the seasonal light changes amplify depression if you already have it.
Okay, this is something that it's important to be aware of. It's an interesting outbreak of pneumonia in Ohio, and of course, this is the season for that to occur, and it's not surprising that pneumonia is increasing during the season, and of course, fever, cough, fatigue, chest pain, coughing up bloody or rusty sputum uh, is sometimes one of the consequences. And we have all kinds of pneumonias. We got viral, we got bacterial, we got mycoplasma pneumonia. I think one of the most important things to do is to, if you have any shortness of breath or chest pain or or any kind of infection that lasts longer than 5 to 7 days, you need to see a doctor about it. These are the signs and symptoms that you see, and these all go with pneumonia, but they go with a number of other things as well. But I think that anything that lasts more than 5 days is important to see a doctor about. Of course, if you have a temperature greater than 100, and if you get this, then it goes a step beyond the URI, because this then talks about actually pneumonia, and also tuberculosis presents in the same kind of fashion. And of course, if you have tips of fingers. Well,
Mhm.
all of these symptoms here are signs that you need to go to the emergency room. Because if not, you're going to die at home.
I'm surprised they didn't mention the vaccine for pneumonia.
Right. And of course, yeah, they don't mention that. But as we all know, there's a vaccine for pneumonia as well, particularly for those of us who are over 65. Now, this is an expected change in CVS drug pricing formula, which is very desirable, and it would decrease the amount that you pay for drugs. This is timing is good because there's a crackdown in many areas over big pharma making so much money on its drugs, and so we've had a number of articles on ways in which you can get the pharmacist to decrease the amount that you pay for medications. And this CVS pricing model is the most recent. I don't know when it's going to manifest itself, but it's something that we can look forward to.
They said starting in 2025.
Yeah, well,
Yeah, the
so we
CVS
got to be around.
in 2025.
Yeah, we got to be around.
Yeah.
Nikki Haley wants to make a difference. Question is this going to happen? We often encounter people who want to change Social Security and Medicare. The question is, how do we do that and still maintain it? Most people over 65 are drawing on this Social Security benefits, and there's a concern that this pool of money will run out. So how do you manage to save it? Yeah. I don't have any idea. Nikki Haley says she does, and I think the presidential campaign will have people identifying how they're going to recommend changing. However, with politics, we recognize that some of these are just ploys to get us to vote for them, rather than to actually make a significant change. And so, anybody else have any ideas about whether any of this is likely to become reality?
I have one. What they need to do, I've heard some people say in the past, I think Bernie Sanders said it the first time I heard, they need to continue to tax people that make more money. They have a cap on how much what amounts of money they can take from the highest earners. And they need to raise that so that they're still paying into Social Security, because you can best believe Trump is accepting his checks every month.
Any other comment?
I also feel they need to pay just the everyday workers a livable wage, and if they pay them a livable wage, they will be taking more Social Security, because the Social Security payment is associated with how much you make. But today's the children are making little to nothing. Some jobs are $11.50. Even the highest minimum wage, $15, $15.90, is not really enough to live on in today's society. So I think if they gave everybody a livable wage, those people that are working, the Social Security fund would go up because people would have to put more in. It would be automatic. But
Any other ideas or thoughts? All of them make sense. So, okay. Well, I think we have to be aware of those things because they continuously talk about in 2030 that the money for Medicare and Social Security will run out. Now, this is an article just came out that says getting RSV and the flu vaccine together is safe for older adults. So, those of you who haven't gotten it yet, the RSV anyway, and can get it together with the flu. There have been a number of articles that have talked about getting the vaccines together. This is the most recent. We're in December now, so this is a time for all of us to have all three of the vaccines. Okay, let's go to the next one. This is something. This is an article that says that the flu vaccine may protect against heart attack and cardiovascular events. It's an interesting concept. And associating things that have no relationship is something that we do all the time. So whether this will be borne out over time remains to be seen. And this is the 4,000 patients were studied. So time will tell. That's the same. Heart attack and cardiovascular deaths. Flu vaccine. I think all of us are vaccinated, so.
Yeah. Yeah.
When you look at HRs, if it's greater than one, that means that you have an increased likelihood of death. If it's less than one, it means you have a decreased likelihood of death. And this associates flu vaccine with a decreased risk of cardiovascular events, heart attack, and death. That's what the data suggests. So. Okay, is this the last one or is there another one? Oh, well, this is interesting article. And what it says is that exercise is good, but those people who work real hard and actually kind of overdo it wind up having dementia later on in life.
Well,
So they're saying that exercise is good, but overdoing it, the end result is that you get dementia later on in life. And so this is what this study is really addressing, saying that, yes, the right amount of exercise is good for you. But those people who have physical exercise jobs like constructive workers and those who really work hard pay a price for it later on in life, and that price is increased dementia. So that's food for thought, and I guess we're going to have a lot of studies on this subject to find out if hard physical work is bad for you. We know that physical exercise is good and weightlifting is good, but how about those people who spend all their time working outside and doing physical labor? And the data that they have accumulated here suggests that there's an increased dementia risk in that population.
Thank you.
Yeah. Go ahead.
What do you think about that?
I know I'm gonna get my husband off his chair now.
What's that?
He's gonna think.
So,
Go ahead.
I think there's so I think there's a correlation between working hard, exercising too hard and not eating right versus exercising and eating right. So I've seen just a few quick YouTube videos of gentlemen who are in their 60s, 70s, and they still have cut up muscles and things like that. And they brag about how well they work out. But what's noticeable is what's remarkable is that they also talk about their diet. They cut out a lot of foolishness and they try to eat healthy, and I think that's what kind of supports their longevity in that. Um so I guess to the point of the article, it may be just exercise alone, but I think nothing's wrong with exercising well, as long as you're balancing that with eating well and proper rest and all that other stuff as well.
Well, I think this article is also saying that those people who not only exercise but who actually work hard on the job, and their job is physical activity, that they have a paradox in the sense that they work so hard, but when they get into their 70s and 80s, that they have a higher risk of dementia, and so that's what is the paradox, that they're suggesting that the harder you work in your job, the more likely you are to have dementia, in contradistinction to those people who are doing the exercise for health reasons, and they have a limited degree of exercise, whereas those other people who are just working hard are perhaps in some way, the paradox is the harder they work, the more likely they are as they age to have cognitive defects. It's going to be interesting to see if this pans out over time, but that's what the suggestion is. That
Dr. Callender, on the other end of the spectrum, having a desk job all your life is not good either.
But that's not exercise. So yeah, that's true. And they just haven't studied them. But I think what many were hoping is that those people who work real hard did as well as those people who exercise a lot. And this data is suggesting that those people who work real hard wind up with dementia later on.
I bet it's another factor in there. I bet it's a factor of what they eat, just like Mark said. Because
it may be, but that hasn't been studied. So.
Yeah, and the people that do the physical work, they don't make as much money. And when you don't make as much money, you don't eat. A lot of times you don't eat as well because cheap food is bad food. And that's the food that you buy.
And you get
when you don't have a lot of money.
Well, that hasn't been studied, so yeah,
and depression,
you may be right. This is a kind of unfortunate study in which they recognize the people who had, we talked about colonoscopy and endoscopy, and one of the risks that is associated with endoscopy is the fact that at this place they were not cleaning the instruments appropriately. And as a consequence, the people who had the colonoscopies were exposed to excessive risk for HIV and hepatitis.
Oh my goodness.
And so therefore they were suing them for that. But this is something that has been identified before. And that's one of the other reasons why they're talking about the high risk for colonoscopy, because there are other I think you had mentioned earlier that the anesthesia is a risk, but also are the instruments that they use for the endoscopy procedures, if they're not cleansed appropriately. This is a situation where this did not occur, and so these people are at risk for HIV and hepatitis. Yeah.
My problem, Dr. Callender, is how would you even know that you had it after the fact? Because HIV may not show up for years down the line.
Same is true with hepatitis C. Yeah, you're right. And so therefore, what this means is those people would have to be studied and have to do tests for the virus, see if the virus is present. That's the only way they would know, unless they actually came down with the disease.
And then there's the statute of limitations, so that they can sue after they find out.
I don't think there would be a statute of limitations. I think they would fight that if you were found to have the disease. I don't think that would apply.
Yeah, how would you even know that it came from the hospital?
If you had a procedure at that hospital, then the likelihood of it is increased.
And suppose you're a drug user.
Yeah,
Say
I was
again?
gonna say, gonna say, yeah, behavior. You know, the person's personal behavior kind of determines that. You know, if they don't engage in any other risky activity, and they know that the only activity that happened was that procedure at that hospital, all signs can point to that. But you know, so it depends on their behavior.
Well, remember back in the day before they had the good tests for HIV, and people were having different procedures and contracting HIV, like Arthur Ashe had his heart operation and ended up with HIV. And there were a number of other people that had situations like that.
Blood transfusions, right?
Yes. And those little boys that had hemophilia, they contracted HIV through
from blood transfusions.
Right. And
okay, well, this is interesting that people are still dying from COVID, and it's unfortunate because it's preventable for the most part. It's one of the things that makes it less identifiable is the fact that it's not as bad as it was several years ago, but it's interesting that COVID is still killing people. So, so we have to be sure that we've got our COVIDs and our flu and our RSV shots. That's the moral of the story. It's 10:30, so this should be the last one.
Dr. Callender, I heard yesterday, if we finish with the articles, I heard on the news yesterday about doctors, primary care doctors, some of them now going to something called concierge medicine, where you pay extra for your doctor to be available to you. It's a fee you pay.
That's rich people.
Heard about that?
Yeah.
Well, it's like $1,500 a year or something like that, $1,200 a year. But a lot of primary doctors are going to that and leaving their regular practices to their
less money.
To their
Intern.
either their interns or the what are the other people that that they have taken care of their patients.
Nurse practitioners.
Yeah, nurse practitioners. But
$1,500 a year is not a lot of money. It must be more than that.
no,
They
that's
can
what
make
they
that
say.
on a month.
No, but if each patient, if you want to have that concierge medicine, you would have to pay. I thought they said between 12 and 1,500 a year.
Yeah, it'd be interesting if you could find an article and we can discuss that next week, because that's an interesting concept.
Yeah, I thought it was as well.
Yeah, very interesting.
And I have a question, a personal question for you. Do you remember a doctor at